Hi, a very good evening. I believe you are doing quite well. This evening, I just want to share some thoughts with you. We are at post, we are working, but I just want to share my thoughts. So as soon as you come across the video, wherever you are, I want you to share so that other people can also have access and watch. And this evening, I'm asking a simple question: that how long can one survive after testing positive to the hepatitis B virus? Let me be quick to say that we are having a liver specialist clinic in Accra, which is on the 8th of May. So you can get in touch. Tomorrow, our team will be in Accra to conduct all your lab tests at a reduced cost. So you're also invited. You can just pick our contacts and then call us, get in touch with us so that we do this for you. I'm asking a question: that how long can one survive after testing positive for hepatitis B? When you test positive for the hepatitis B virus, you are expected to live a normal life. You are expected to live a normal adult life without having any challenges or without having any difficulties. Just like in any other condition, when the condition is detected, is important in determining how long you can survive. What it means is that when you are diagnosed of the hepatitis B and your liver is not damaged, then you should expect that systems will be put in place to prevent liver damage, and that also prolong your survival. When you have tested positive for hepatitis B, it does not mean the liver is damaged. What it means is that there is a presence of a virus which increases the risk of liver damage. Let me repeat that again. When you test positive for hepatitis B, basically it does not mean that the liver is damaged, but what it means is that there is a presence of a virus which increases the risk of liver damage. Though there are some individuals, due to the silent nature of hepatitis B, who will be diagnosed when they have developed liver cancer or liver cirrhosis. For that, it might have gotten to a stage that not much can be done unless a liver transplant. But the question is, how many people can afford liver transplant? That is why it is important that when you are diagnosed early, you stick to doctor's advice, you stick to the plans and other things that we share with you daily, so that you can be able to stay as long as you have been given. So those who are Hep B positive should expect to live a normal adult life without having any issues. You can have hepatitis B and survive to the length of time. So please bear that in mind, that when you have hepatitis B, you don't need to let anybody deceive you that tomorrow you are going to die. So come and buy a medication or come and get something that is going to help you. Though there are a lot of drugs out there which may be beneficial to the system, but at the end of the day, understand that they come back to the liver, which may rather cause damage, especially with these herbal concoctions, with medications which we can't authenticate or know the source as to whether they've been registered for use. So please, I want to encourage that you don't just stick to drugs, or you just don't go about taking medications because somebody recommended or said that they are good. When you are hepatitis B positive, the key thing you must know is that doing the further labs, a profile test, liver function test, viral load, abdominal scan, and doing a cancer screening once every year, it is what will determine how long you can survive. When these labs are done and there are any changes in the liver or the liver is being affected, these are the labs that will help us to detect. When you have hepatitis B, majority of us who are positive today might have had the disease from our childhood, and you can attest to the fact that even the day you were diagnosed, you were not feeling sick. It's just a few people who were diagnosed because they felt ill, but majority of us who were diagnosed, it was because maybe we wanted to donate blood, went for a medical examination when we were pregnant. So that one we call it accidental diagnosis. Not that we deliberately went to do a B test, but we were doing other things and they got to know we had an infection. So the moment this happens, then it means that we must do further testing to know how the liver has been affected. After the test, it's suggested that every 6 months you see a doctor. There is a need for you to see a doctor at least once every 6 months. There are people, depending on their condition, they are asked to come every 3 months, depending on the initial findings that we ascertain. So all that I'm saying is that to survive with hepatitis B is about what you do. And what you do is to do the various tests to be monitored, to be assessed by a doctor more regularly, and then the lifestyle changes. What you eat, the lifestyle you engage in. So what you eat comes back to avoiding fat and oil, eating more fruit and vegetable. You can eat any food you want as a hepatitis B positive individual. There is no food that you must avoid. I know people don't eat granite, people don't eat palm nut soup, people don't eat granite soup, people don't eat a lot of food. I mean, when you're hepatitis B positive, there is no food. Don't let anybody deceive you. Just that there are some of them that you must take in moderation. I know people who are B positive don't eat, some people don't eat meat. It is a lie. Don't let anybody deceive you that when you're hepatitis B positive, you cannot eat meat. That is not true. But all that we are saying is that the fatty content of the meat is what you shouldn't take. And you shouldn't even consume more animal protein. You can do more plant protein, or you can do fish. That is all that we say. And then when we come to the lifestyle changes, that is when we talk about avoiding alcohol, exercising, so that fat do not build up in the liver. So this evening I have come to encourage you, and I have come to tell you that when you test positive for hepatitis B, you can survive to the day that God gave you. It's all about early diagnosis and what next you do after the diagnosis. I have lost a couple of patients, Hep B patients, and it wasn't because the virus killed them, but it was because they had resorted to roaming from one hospital to the other, one herbal hospital to the other, taking concoctions and other medications. At the end of the day, it was the medications they took that destroyed the liver and not the virus. So when you have hepatitis B and you are being monitored, doing the right thing, you should live your normal life without having any issues. Some of us, before we were diagnosed, we were not even feeling sick. But all that you must understand, as you age, then the impact of the virus on your liver will also be felt. That is why you have to do the labs, so that if any changes have occurred, then you can be started on treatment. We at Healthy Liver Foundation Ghana, as we always say, when you test positive for hepatitis B, it is not a death sentence. Don't let anybody deceive you. Don't let anybody make you feel that you are dying tomorrow. You follow us, follow our advice, join our WhatsApp support group, be part of our virtual conferences, be part of the other things that we are doing. Ask your questions, and we are always here to help you. For those on radio, those on TV, those who claim to be doctors and herbal selling their medications, forget about them. They are not the right source of information about your condition. You can always contact us, and we are here to help you. I want you to know that you can have hepatitis B and survive for 100 years if those are the years that God gave you. It's all about what you do, your labs, what you are eating, follow up, test, and checking. Don't wait to fall sick before you go for a checkup when you are B positive. No, you must always go. So after the initial one, your doctor might say 6 months, 3 months, 1 year. Then you follow up on it. And I believe you me, I have people who are 80 years, who are 90 years, who are 70 years, who are 75 years, who grew and they died, and it wasn't even because of the Hep B. Even that one did not kill them, because of diabetes or hypertension. So when you have hepatitis B, just calm down and take the right move, seek the right information, and it is going to help you. Enjoy your weekend. And as I said, share the video. On the 8th, we are having a liver specialist clinic. Come so that the specialist will assess you and tell you what you can do. Please, what can I do with lifting and fasting? Okay, so I made a post with the fasting, especially for our brothers who are in the month of Ramadan. When you have hepatitis B and you don't have any complications, you can fast. I believe your fasting is not continuous for, let's say, the 1 month without food. No, that is when it becomes problematic. But when you break the fast, you are going to eat, then that is fine. So you don't have any troubles, you don't have any issue. But with the weight lifting, it also increases. When you lift heavy weight, it increases the liver enzymes. So please, with that, you might have to minimize it. You can still exercise, but it shouldn't be very excessive. Can hepatitis B travel outside the country? It all depends on the country you are traveling to. When you are traveling outside the country, it's dependent on the country you are going to. I know there are some Asian countries they don't permit, but there are other countries like UK, America. It depends on the condition. You see, once you've tested positive, they try to do, further checks to know. And it also depends on the kind of visa you are seeking for, the immigration visa you are seeking for. So please, I know people who are in America and other places who are Hep B positive. There are others who also claim they were refused, but I'm not sure the reason they gave them was because they were Hep B positive. Yes. And then someone is saying that, yes, so you can also drop your questions, and when I come across them, I'm going to answer. Yeah, so if you want to be part of the WhatsApp platform, send a message to 0246 31 0663. Just send a WhatsApp message and just ask that you'll be added to our WhatsApp support platform, and I'll gladly do that. So please stay safe, and as I always say, be happy, enjoy your life. Don't let anybody make you feel you're dying tomorrow. Have a lovely weekend.